Ask Dr. Nandi. Today, we've been learning about pancreatic cancer. We've learned about how deadly it is. And one of the main reasons it's so deadly is because it's hard to detect. Many of the symptoms we associate with pancreatic cancer are also associated with other mild gastrointestinal issues. Some of the symptoms include loss of appetite, nausea, back and stomach pain, and even weight loss. Now, raising awareness about this disease is important to try to find patients early. When treating a patient with radiation, chemotherapy, and even surgery, there are many side effects. Now, today, joining me is Dr. Sheba Roy, who works with patients at these crucial times to help curb these side effects. Please welcome her for me. Thank you very much. Welcome back. Thank you very much. So, pancreatic cancer, very tough disease to treat, and then lots of side effects with the treatment. So how can you help them?
It's a great question, and so I think it's best to start with a little bit about what I do. So my job is to partner with medical oncology, surgical oncology, radiation, to help patients to manage the side effects from chemotherapy, radiation, surgery, as you just mentioned, and also preserve quality of life. So with pancreatic cancer, we're talking about weight loss, we're talking about appetite loss, we're talking about taste changes, and including the side effects from the drugs themselves. And you know, this population is so vulnerable. So a huge part of what I do is help those patients to navigate everything that's out there on the internet, all their friends and family, everybody who's an expert in what natural therapies they should be taking, and direct them towards the ones that are safe, evidence-based, and cost-effective. And that's so critical for this population.
And you're a naturopathic physician, right?
I am. So I have the conventional medical training plus training in natural therapies, but I'm boarded on the interaction between drugs and natural therapies in an oncology population. And what that means is I'm an expert in how cancer patients are going to react to natural therapies when they're going through chemotherapy, radiation, and surgery. There's really only 70 of us in the country and 2 of us in Michigan.
Oh wow, so we're lucky to have you.
We are,
yeah. So they're very vulnerable, you said. And what are the challenges that you face in this population? Because I think that she treats other types of cancer besides pancreatic cancer. What are the challenges with this?
With specifically pancreatic. Yeah. So, for example, for each cancer type, there's drugs that you may use, and one of the most common drugs that is used with pancreatic is 5-FU. So one of my jobs is to prevent dose-limiting side effects from chemotherapy. So when I'm talking about dose-limiting side effects, what I mean is this drug is it has its best effect if it has this amount of exposure to a patient, right? And if they have to dose down on that drug, or they have to take the drug away completely because of the side effects that the patient's experiencing, then the patient doesn't get that full exposure. So dose-limiting side effects with 5-FU include sores in the mouth and diarrhea. Well, with a patient population that's already losing weight, that's having difficulty with what's called early satiety, meaning they feel full very fast.
Right.
Having sores in the mouth and having diarrhea are obviously going to contribute to weight loss.
Right.
And weight loss is a big prognostic factor, meaning a factor in telling us how well a patient's going to do further down the line. So being able to prevent sores in the mouth and prevent diarrhea is incredibly impactful in their treatment, and I can do that beautifully using very simple natural therapies, such as educating them about what changes happen in their gums and with their saliva before they get sores in their mouth, and then using a baking soda lemon wash throughout the day to prevent the sores in the mouth as they happen, and then using other things like folic acid wash, swish and spit with glutamine, which is an amino acid. All of those things are incredible in protecting what's called the buccal mucosa, or the cells that line the mouth cavity. Great. That's just one example.
Well, those are great examples. And something else that you said is very important is that the internet is this very bizarre place, where you can get all kinds of crazy information, and if you and somebody like yourself can actually help to navigate through there. Now, are there treatments besides to combat or help with the side effects of chemotherapy? Are there natural treatments that actually can help pancreatic cancer that you can at least try to dabble in?
So here's the thing, Dr. Nandi. It's not legal in this country to treat cancer using natural therapies.
Okay.
So it's a very tricky
Got it.
place, because patients will go on the internet, as you said, and they will see all sorts of quote-unquote cures for cancer.
Sure.
Does that mean that natural therapies don't have curative effect or curative potentials? No, it means that we don't yet have evidence to show us that something like curcumin, which, as you may know, is a root from India, has the same ability to be anti-neoplastic the way 5-FU would. However, we do have clinical trials that show us if we combine that herb, like curcumin, with a drug like 5-FU, we can make that drug stronger towards the tumor cells while being normal protective to the other cells. Now that herb, curcumin, however, is heavily contaminated. There's a solvent that's remaining on it. Most of it's sourced out of India, and that solvent causes cancer. So there's only a couple sources of it that are safe to use. It needs to be taken in very high doses. In order to be bioavailable, it has to be combined with a fat. So this is one of the ways in which it's very important to see a naturopathic doctor who's board certified in oncology services to be able to navigate that terrain. Does that make sense?
Absolutely. It's great advice, because what you're saying is that even though on first blush, when you look at it, this is a great product and we can use it, but even with that, you have to know so much more to make sure you don't hurt yourself more than you help yourself.
That's exactly right.
Well, thank you for helping us. That's
yes,
great advice.
No problem.
I appreciate
Thank
it.
you for having me.
Of course. We'll take a quick break. When we come back, we'll be joined by our favorite energy healer, Elaine Groman, and she'll talk to you about how she can help with pancreatic cancer and some of the side effects with treating pancreatic cancer as well. Please stay with us.
As I got in there, this gentleman comes running in and he stops, and he was the anesthesiologist, and he looks at me and goes, "You're doing energy work, aren't you?" And I said, "As a matter of fact, I am." He goes, "I don't know what the heck it is you do, but I wish I had an energy healer in every recovery room."
Oh, wow.
He says, "Because I see it work."
We're back with you now. We have some questions from our studio audience. Yes, please, go ahead.
Hi, thank you. I've heard that there are many types of pancreatic cancer. Are they treated differently?
Yeah, it can be. That's one. So do you treat all of your pancreatic cancers the same, or tell us about that a little bit?
The pancreatic cancer that we've been alluding to is adenocarcinoma, which is a deadly pancreatic cancer that we talked about with Patrick Swayze, as opposed to Steve Jobs, who had a neuroendocrine, which is probably the second most common type of pancreatic cancer. But that's only about 5% of all the pancreatic cancers that's diagnosed. So there are different treatment algorithms for the smaller subset populations of pancreatic cancer that a pancreatic surgeon and a team is very comfortable dealing with. But the devastating one is what we've been talking about today.
Great question. Yes, ma'am.
What are the main side effects from chemotherapy for pancreatic cancer?
Now, pancreatic cancer by itself has so many basic symptoms that can make you feel terrible. I'll start with Elaine. What do you think? What are some of the side effects that you can get with treatment?
Well, the clients that I've worked with, they've had nausea, they've had pain, they've had fatigue. You know, sometimes if they've had a Whipple procedure, certainly they have the wound pain, you know, that has to be healed. And if you can help that, but there's, I would say fatigue, loss of appetite, loss of weight, and if they've had chemotherapy, more than likely neuropathic pain.
Great. Dr. Roy, what do you think?
I would agree with that. And also with chemotherapy, so with 5-FU, we see mucositis, which we talked about earlier. There's sores in the mouth, diarrhea, as Elaine is talking about neuropathic pain, but also hand-foot syndrome, so peeling of the hands and feet. It's called palmar plantar dysesthesia, which is a fancy way of saying that. Those are some of the side effects with 5-FU, and then with gemcitabine, we see a whole different ballgame. But fatigue is very common, early satiety, nausea, and taste changes.
Yeah, and then that makes it. Dr. Juan, what about side effects from surgery? We talked about it in kind of a general terms. What specifically what can people look for when they're looking at this big surgery? What kind of side effects?
The most common cause symptomatology we've talked about is pain from the surgery in of itself. From a bodily standpoint, the bowel functions tend to get significantly altered, where you may either alternate between having very loose stools or being extremely constipated. And it's really working in a multidisciplinary team like this where you have people who can identify the symptoms that you're having and to really work with you in natural ways or in pharmaceutical ways to really help regulate your bowel systems, which can be a major issue after a surgery such as this.
And if I could just jump on
Please,
that.
yes.
So post-surgically, in that first couple days after surgery, you might have a bowel regulation program that's pharmacological. But after that, you would need probiotics, definitely to help regulate that gut flora and help regulate
Give
the
the good
bowel
bacteria
function.
back after you've
Exactly.
devastated the whole place.
Exactly.
So, and this is an important opportunity to talk about that. You got to be really informed when you have surgery. Lots of us, you would not believe how many people have surgery and have no idea what surgery they're having, why they're having it. People come to me and they go, I said, why'd you have this surgery? I don't know, they told me I should have it. And why it's important, it sounds crazy, right? You would not believe how many people. First, important to know what surgery you're having. Number two, what the side effects are. Chemotherapy, what to expect, because when you know what to expect, you can at least have a fighting chance in getting past it. And whether you use energy medicine, whether you use naturopathic medicine, whether you use pharmacologic, which means meds, just drugs, you at least know what you're handling. And that's extremely important that you get yourself as informed, be an advocate for yourself, because then you know what to tackle. And if you listen to Sheila, she really is very well informed. She knew what to expect and then just went right at it. And when you do that, you have a fighting chance against a deadly disease like this. That was a great question. We have to take a break. When we come back, we'll have more great questions. Stay with us.
It took a while for a friend of mine to be diagnosed with pancreatic cancer, and I was just wondering, what is the best test for diagnosis?
Welcome back. We have more questions from our studio audience. My favorite part. Yes, please go ahead.
Hi.
Hi.
It took a while for a friend of mine to be diagnosed with pancreatic cancer, and I was just wondering, what is the best test for diagnosis?
Yeah, it's a great question, because one of the biggest problems is finding this cancer because it's so hard to find. So a CAT scan, which is a fancy X-ray where you kind of go in this little donut, may not catch it sometimes. Even MRIs may not be good enough. Sometimes you have to do a procedure called endoscopic ultrasound, and what that is we take a little scope with a little ultrasound, which is another technique in which you actually go in the mouth, into the stomach, and actually look at the pancreas. Dr. Kwan, so what do you think? I mean, it's tough to diagnose these cancers sometimes. What do you think is the best diagnostic
I certainly
test?
agree with you with the endoscopic ultrasound is probably the least invasive but most accurate way to go looking at the pancreas. And I think if there's even the slightest suspicion, some blood work, specifically a cancer marker that we know is available for pancreas is something called a CA19-9, which is very easily drawn just with simple blood work. With those two things, we could probably get a better idea of exactly what's going on if there's any suspicion.
An endoscopic ultrasound test is, where you are, and I do that procedure, but you may be in a place where they don't do that. If you or a loved one that they suspect has pancreatic cancer, find someone who's doing an endoscopic ultrasound. So it's important. It's also short, there's a short name for it. It's called EUS. The key is that sometimes people will say, well, all the tests are negative, you must be fine. You can't accept that answer because often you miss that chance for taking out the tumor, making a cure possible, and that's when you can get these when they're small. So be persistent, be an advocate for yourself, and if you're in a place where you can't get an endoscopic ultrasound, find another area, a city that's close by that can do that. So great question. Yes, next question.
Hi, I've been listening to Elaine, and I actually read her book on energy medicine. So my question is it bad energy or lack of the right energy that causes problems like pancreatic cancer?
It's a good question, and we talked about bad and good. We only have about a minute to answer this, but what about this whole concept of bad energy?
Bad energy does not exist. The bad energy is up here and what comes out of our mouth. What we need to think about is energy in its purest form is neutral. It is available to us all. But there's low frequencies of energy, which may be what would be causing somebody to not be well because the full system of the body is not working. Or there's a higher frequency of energy, which means that person has vitality. They have health, they have good blood, they have functioning immune system, etc.
Right.
So there is no good or bad. There is no negative or positive. There's high or low.
And so the idea is that, you know, the energy, it exists, you make it work for you. It's like anything else in life. It's almost, I'll say it a very simple way, is that, you know, your mom always says, you know what, have a great attitude. If you have a great attitude, then, you know, you'll go far. It's not very different from that, you know, because that attitude, we learn that actually changes, it can actually affect the result of something. It can make cellular changes. So what happens is that the good and bad energy concept is kind of one that's antiquated, and we know now energy can be used in many ways. So thank you very much for all of you for asking these wonderful questions. I appreciate it. We have to take a break. When we come back, Partha's prescription.